Recording in progress.
Hello, we are going to go over how to chart. It's just a little refresher on how to do the chartings. So we're going to review it and make it a lot simpler. So this is the SOAP note template, which the SOAP note is just a subjective objective. So subjective objective, the assessment, and then the plan. So every day you'll fill this out on a client. You put their name, the date of the service, what time you started it, which is generally about 8 o'clock in the morning, to what time you finish it, which is usually about 2 o'clock in the afternoon. And then you can multiply out those minutes. And then you report anything the client told you or that you heard them talking about that is applicable here. And so this can be kind of different than how we're accustomed to doing things, because this is where you're looking for the negative, not the positive. You're trying to show the different entities why the person should be in treatment, not the reasons they shouldn't be in treatment. So it's a different approach, a different perspective than what you might typically look at. But have you seen the person be in a bad mood or getting into arguments with other people? Have you heard the person talking about things that stress them out or that are frustrating to them? Do they have poor insight? Are they saying that it's dreary outside when you're seeing nothing but rainbows and butterflies? This helps to articulate things that they are seeing that may not be the norm, quote unquote. You can also talk about spiritual conditions. So are they saying that they believe in God or they don't believe in God? They're having a crisis of faith, or they have recently come to faith. That can be very important in this client report, as well as cravings. So a lot of people feel shame when we talk about cravings, like they feel shamed that they're craving a drug or something like that. And that's not something that we need to shame them for. It's that we need to acknowledge it. The Bible actually says that we are to confess our sins one to another. And so if they are having cravings, if they're reporting nicotine cravings, drug cravings, it can even be cravings of another gender or same gender. Report those things here. And then any challenges they're facing. Hey, I'm having trouble sleeping. I'm having trouble getting my homework done. I'm having trouble getting along with someone. Any challenges that they're talking about. I'm having trouble staying in the program. I want to leave. You would mark that here. And then client statements in their own words. This is a great place where you can further articulate the things that you saw up here or heard up here. Again, this needs to be more focused on the negative than on the positive, because you're trying to prove why they need treatment, not why they don't need treatment. And then risk-related self-reporting. So did they talk about wanting to hurt themselves or wanting to hurt somebody else? Did they talk about past self-harm opportunities, or that, that could be a craving just the same, like that's something that they're wanting to do. So you would articulate it here. And then substance use urges or cravings. So you will notice that it is articulated here. It can be articulated here, and then it's also articulated here. This is extremely important. If they are talking about it, if you've heard it, if you know it, you need to make sure and state it, because we want to make sure that we are addressing it with all four quadrants: bio, psychosocial, and spiritual. Now, on the objective, what did they look like? This is your observation. This isn't what somebody else saw. This is what you see. What did they look like? What kind of behavior were they presenting? Were they just flat, where they didn't really have just kind of a monotone behavior? Or were they constricted, where they just didn't say anything or do anything, kind of hide in the corner, fall between the cracks? Maybe they were anxious or labile, or maybe they're appropriate. Most of our people, I would say, are appropriate throughout the day, but we're looking for those negative things specifically. And they can have multiples. I've actually had somebody that I would say went through appropriate, flat, anxious, and other in one 50-minute session. So it's okay to articulate or to list multiples. We just have to be able to explain why we did that. And then what's their engagement level? Are they actively engaged in conversation, or are they just kind of sitting back and watching everything? Or do you have to continuously call on them? That would be minimal. And withdrawn is like falling asleep, not even like leaving the class, those kind of things. And then disruptive would definitely be like leaving the class, talking over other people, refusing to do what you're asking, etc. This is also where you're going to list how they participated in PSNL, GSNL. Did they complete their reading? Did they complete their homework for that day? And it's not, we can get into the habit of going, oh, well, they have a week to finish this, or they have a month to finish this. No, what was it that they were supposed to do today? Did they get through that today? And then, did they contribute to meaningful discussion? Did they have anything to say that was appropriate, or was it like off the wall? Like, we're talking about this and they start talking about Noah's Ark, and they start talking about summertime and going to the beach when it's cold outside, or vice versa. We're talking about it's summertime and they're talking about Christmas and snow. So did they contribute to meaningful discussion, or did they just have random things to say? Did they practice the skills they had been taught? So self-control, meekness, patience. Are they exhibiting those character qualities that we teach? Are they exhibiting the behavior patterns that they're reading about in their group and personal studies? So you're articulating those things. If you're not seeing them, that's just as important as seeing them. If we're seeing them, great. We need to say, hey, we're seeing this stuff. But if we're not seeing them, instead of it just kind of falling through the cracks, we need to be able to articulate it so we can make a more intentional approach to getting those behaviors that we want to see. And then related faith principles to recovery. What is it that how are they using recovery to help them to get better? Observe distractions or disengagement. I can tell you that today I have been kind of distracted with a bunch of different things going on. Our clients they shouldn't have those distractions, because they aren't doing the things that we do on the norm. And they're needing to stay focused on their GSNL or their PSNL or a particular assignment. They're not needing to focus on the 15 different things that you and I have to focus on every single day. So if you observe them being distracted or disengaged, it's important to notate that. And then if you're having to redirect them or encourage them even a lot, it needs to be notated. So we see, Kate's struggling. She had to come in here and she needed some encouragement about A, B, or C. Make sure that you're articulating that. I've seen a lot of people sober peer, and I think some of y'all do an excellent job at that. Some of you probably could maybe make that your intentional project for this week of, hey, let me make sure that every time somebody's needing that encouragement that I am articulating that out. But making sure to notate it is extremely important. It's also important that you notate your GSNL and PSNL of the day. So what GSNL lesson are they on? What PSNL lesson are they on? What is it that they're working on? So again, all of this could literally take you about 3 minutes. I like to keep this as a running tab, but I will do this on the back of a piece of paper. That way I can articulate, or I can minimize it down to like the most urgent, most important things at the end. This right here shouldn't take you but about 30 seconds to go through it. Then the assessment. Are they better today than they were yesterday? Are they a lot better than they were? Or a little better than what they were? Or are they not making any progress? I will tell you that if somebody's not making progress, that is not good. It is better to regress or to have minimal progress than to have no progress at all. The reason behind that, it's kind of like the Bible says it's better to be cold or hot, not lukewarm. No change is that lukewarm, and it is not going to help them to stay in treatment. It's not going to help them to reach their goals. It's not going to help us reach our goals. So it's important that we're identifying these things, because if we're seeing no change, then we need to start working on that. If we're seeing minimal change, we're going to treat it kind of like the no change. And if they're regressing, then there's some things that we can do to really work on that as well. And then an explanation of progress. What is it that they are doing? Are we, client demonstrated growth in emotional awareness and humility by acknowledging resentment patterns during the anger and personal rights. Client connected biblical forgiveness with relapse prevention skills and verbalized a desire to walk in renewed thinking. That's a whole lot of words. What I would see in that is Kate was able to demonstrate growth in emotional awareness and humility by acknowledging resentment during the anger and personal rights lesson. She connected biblical forgiveness with relapse prevention because she recognizes that whenever she's angry, she does things out of spite and out of self-sabotage as opposed to out of thinking it through. Like she's really just being impulsive because she's angry rather than being mature. We're to be mature Christians, not babies in the faith. And so articulating that out. This is probably the one that you're going to think through the longest. And if you need help, I can get you some questions that can help kind of to spark those ideas on the assessment. Safety assessment, is the person saying that they're wanting to hurt themselves or somebody else, or they had they mentioned something that you were like, I'm kind of concerned about this. Can we have them meet with a therapist or somebody like that? That's where you would put it there. And then the plan. So the plan is what are they going to do either as homework or tomorrow. So they need to be working on reading their book, Me and My Big Mouth. Or they need to be working on their workbook, Anger and Personal Rights, or scripture memorization, or we're going to an offsite, we're going to a church retreat or something like that. Those are things that you can put in the homework assessment. The behavioral skill practice, this is a great thing for you to be able to remind yourself and them of, hey, remember your box breathing today, or remember how you're going to practice forgiveness or gratitude. It's a great one of, hey, remember you're going to be working on gratitude. So write 5 things you're grateful for. Those kind of things. And then support meeting attendance. This is going to be Teen Challenge 101. I mean, we are a support group. We are a family. Teen Challenge is able to give people something AA and NA wish that they had in a family. They are very close-knit, but they are not as close-knit, in my opinion, as Teen Challenge, because I have seen Teen Challenge come alongside people and walk with them at 2 o'clock in the morning or 2 o'clock in the afternoon through all kinds of stuff, and we are able to show a true supportive community through that. So you can list ATC, you can list, if you have a church group, you can also list the church group. We can talk about 12-step Christianity, we can talk about Celebrate Recovery, we can talk about all these programs, but you're also able to list ATC under support meeting attendance. And then next scheduled session for somebody that's Monday, Wednesday, Friday, then you would obviously list that next Monday, Wednesday, or Friday. If it's somebody that's daily, then you would list that. For some people, it's not going to be, but, for 2 more weeks. But you really shouldn't have one of these papers to fill out on somebody that's only going to be seeing like a counselor or a doctor or somebody like that. And then staff follow-up. So this is where it helps you to go, okay, hey, I need to share this with the therapist. I need to share this with, I need to get some handouts for this person. So we started talking about something completely unrelated today, but it made me think, hey, I need to bring in some more of that curriculum for people. This helps you to do that. Update clinical team on their progress. So this is where you can say, hey, at the beginning of the week, I noticed this. At the end of the week, we're here. I just wanted to share a win. Or I wanted to share that, hey, at the beginning of the week, Kate was a 10, and now she's at like a 2, and not in a good way. So how we need to work on that. And then this is also where you can say, hey, we need to put some more contract work together, assign a new PSNL or a new GSNL or character quality or whatever. This is where you can articulate that. And then this is a great place where you can also say things like, hey, follow up with their probation officer or they're asking questions about their doctor's appointment or dentist or something like that, this is a great place to articulate that. The reason this is important is it helps you to remember to do it, but it also helps us to chart how that we're working cohesively on the 360-degree person and being able to work with case management and just everybody to take care of them. So that's how you fill out this SOAP note. This SOAP note literally will probably take you less than 5 minutes per person. I'm going to go ahead and fill it out right now. So client name is Kate Riggs. Date of service is 12/1/2025. Start time was 8 a.m. End time was 2 p.m. So at that point, 6 hours times 60 minutes, so 360 minutes. Client reported being in a reasonable mood, had decent insight. Stressors, indicated stressors were completing contract work, having to work in the kitchen this afternoon, and not getting to see her family during the family visit, the campus visit. Spiritual condition, Kate opened in prayer and for the group, and she acknowledged her relationship with Christ throughout the day. Cravings, Kate denies cravings, but was seen fidgeting with an ink pen and often holding it in her mouth as though it were a cigarette. And then challenges, Kate is struggling to sit still during class and get her homework done. Client statements, I love God, and I know He's taking care of the situation with my family, but I do miss not getting to see my family this weekend. That'd be a great statement right there. So it's acknowledging that God's authority, but at the same time, it's acknowledging that she's missing that, and that's a stressor, and it prompts us to go, okay, what about family therapy? What about group therapy? What about talking to the family to see what's going on? Making sure that everybody's insight is accurate, because maybe the family has one idea and Kate's reporting something else, whatever the case may be. The self-report, so suicidal thoughts, no. Homicidal thoughts, no. Self-harm urges, no. Substance use urges or cravings. This is, again, remember I was playing with that cigarette or that pen, and I was putting it in my mouth as though it were a cigarette. You can state that there, or you can say no, but did articulate wanting, did have some physical representation of wanting to smoke a cigarette. If any of these are, if the suicidal thoughts, homicidal thoughts, or self-harm urges, any of those are yes, then you need to get with your program director, the campus, the house director, and then they will get with us, because we do have to go through some steps with that. That does not mean that they're leaving the campus. That just means that we have to ask some questions. We have to make some notes. We have to do our due diligence to make sure that they're sound, safe, and secure. Same thing that you're wanting to do. And then appearance behavior. Kate was appropriately dressed in a t-shirt with a jacket today. It is rather cold outside. She had on pants. She was wearing limited makeup, but her hair was brushed, teeth were brushed, no issues. Affect was appropriate to maybe flat. Maybe I wasn't just jumping off the walls, bouncing off the walls, but I was just kind of flat. But then also maybe anxious, because remember I was playing with that ink pen and putting it in my mouth, acting like it was a cigarette. So you can be flat and anxious, not at the very same time, but like in the same day. And it's okay to show that mood disturbance, that change. It's okay to show that. In fact, it's important to show that so that we can look and start seeing trends. Is she flat in the morning and more anxious in the afternoon, or vice versa? Maybe it's a medication that needs changed. Maybe it is something that we need to walk through with her. And it helps, as a counselor, it helps you to know, hey, she's going to be a little grumpy in the morning, but she's going to kind of flatten out by the afternoon, or vice versa. She's going to be a little flat in the morning, but by the afternoon, she's doing great. So it helps you to know that. Engagement level, this is, moderate minimum. I'd say moderate. Kate was at a moderate level of engagement, and she wasn't disruptive or withdrawn, so I'll just leave it at moderate. Participation in PSNL, GSNL, completed her reading plan, completed her journaling, contributed to meaningful discussion. She was practicing her skills. So if you see me practicing a skill, articulate the skill that I was practicing, whether that was mindfulness, respect, meekness, humility, whatever it is that you saw me doing. Maybe you watched me do box breathing, or maybe you watched me do the 5 senses, or whatever skill that I've been working on. If you watched me do it, articulate that out. And then related faith principles to recovery, so forgiveness, mercy, meekness, you can articulate those. And then any observed distractions or disengagement. So you can say that I was easily distracted after lunch, because that's a key indicator of either it's a good indication that there may be either a food allergy, or that I'm doing it actually to stay awake, so it could be a blood sugar thing even. So very good thing to articulate to catch there. And then if I required any redirection or encouragement, so just super quick to put there. Then what was my GSNL lesson? What was my PSNL focus? Assessment, this is where you, again, this A is what's going to probably take you the longest. It's probably going to take you a couple of minutes. And just think back, okay, how is Kate today compared to how she's normally? Not how is she compared to Johnny or Jane or Jimmy or whoever. How is she compared to how she normally is? And articulate that. And then what did you see? Kate demonstrated a growth in emotional awareness and humility by acknowledging that she gets frustrated when other people are talking and she wants to talk. But she has been able to see that it doesn't have to be all about her, and that she needs to be more meek, and that she needs to be her brother's keeper. You can articulate those things. Safety assessment, she's stable, didn't have any issues. And then plan, for GSNL, she's going to do her GSNL reading overnight, like in study hall. She's going to do her PSNL whenever she has study hall. She's going to, the skill behavior that she's going to work on is going to be listening without interrupting. That'd be a great behavioral skill practice. And then support meeting attendance, again, adult and teen challenge, daily meetings, and program awareness, as well as church group. And then staff follow-up. Want to share it with this therapist. I also want to update the team on what her goals are. So sometimes we call people, have you ever heard of Anita? And it's, I need a this, I need a that, I need new shoes, I need new clothes, I need new hair tie, blah, 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 blah. Whenever we see an Anita no longer become an Anita, that's important to update the team. Like, hey, she was saying she needed all these things, and now she is kind of at peace, and she's calm. And I think that you can ask Jamie, if somebody's saying that they need a lot of things, it's also a key indicator of some PTSD and some, where they've had like food insecurity or things of that nature. So super positive or valuable information to pull out. And then maybe I need to assign my next PSNL. So even though, you're not my teacher today, you're still going to mark that down so that my teacher knows, and you can share it with the team. So that is how you would do the SOAP note. Now, the SOAP note is only done for the AM shift, for like first shift. All right, so this is the second shift. This is only going to be for people that are in residential care. This is going to be pretty fast. It will literally, you once you send everybody to bed at night, you could literally sit down and do this. Now, I would recommend that you keep it as kind of a running thing in your head or running on your clipboard or whatever. I would not recommend you put the the client's full name, well, the client's name here because it is HIPAA protected, but you could do initials or something that would help you to know. The time would be from like 2 p.m. to 10 p.m. or whatever the shift is. And then this is where I would do it by hour. So, how did you act by hour? And if you don't see something here, if you want to say, if she wasn't stable, irritable, depressed, anxious, active, quiet, withdrawn, um, if you wanted to say that I was just something different, you can always put it here in the notes. If there's something that needs to be done, so maybe there needs to be a medication awareness, or there needs to be a training on mindfulness, or there needs to be a maybe I need to see the nurse practitioner to assess my eating, because maybe I'm not eating enough, or maybe I'm getting sick after I eat. Then you would notate it here with the needs and the notes. Medications, this is where you're going to say whether all the medications were administered or if I refuse. So if all the medications were administered as per the EMR, then the medical record system, then all you have to do is check it, because you don't have to double do it. You just check it. Now, if you had to give me some other medicine, maybe Tylenol or stomach medicine or whatever, you would need to articulate it here. So you will have to double do that, but it'll take you about 2 seconds. And the reason that you're doing that is so that whenever we're reviewing this, it immediately takes us to that so that we can see what's going on. Hey, she had a headache, or hey, her stomach started hurting, or whatever the case may be. This is extremely important that when they bring it up to the nurse practitioner or the MD or a counselor, this is helping to solidify what they're saying, because so many times people will say, oh, well, I didn't sleep at all last night, which this isn't for that, but you get my point. I didn't sleep at all last night. Well, did you tell anybody? Because if you didn't tell anybody, it didn't happen, or it did happen, however you want to look at it. So if they're getting up and telling us, then we can articulate it, and then it just supports, hey, they do need help, as opposed to maybe they're just wanting, maybe it's a drug seeking behavior or whatever. If a dose was missed, then you would articulate it here. Maybe I was off campus, or maybe maybe the medication didn't make it to campus on time, whatever the case may be, but you do have to note it. And then any observations after PRN meds. So I took the medicine, 30 minutes later, I was up doing things because my head quit hurting, or my shoulder quit hurting, or whatever the case may be. So groups and programming in the evening. So this is, what is it that I did during the evening? Did I do recovery activities such as playing games? That can also be recreation. I like to put recovery and recreation together. Life skills. Maybe I swept. Maybe I did dishes. Maybe I did my laundry. Those kind of things. So recovery, life skills, recreation, devotional. Everybody does devos, I'm assuming, at night before they go to bed. Great place to put that. Any other chores? So life skills and chores can be one and the same, or they could be separate. So maybe life skills was I was working on a budget, and chores I was sweeping the house, or something different. Showers and hygiene, extremely important that we're notating that for patients, because we need to be able to show, hey, they are taking care of themselves, or hey, they're not. And when you have to remind somebody to go take a shower, that's just as important as if they're not taking it. Obviously, if they're not taking it when you remind them, then that's a whole nother level. But if you're having to remind a grown adult to go take a shower, or encourage them to go take a shower, then that needs to be discussed with the team so that we can start working toward that. And then anything else that they did or I did. Maybe I went to church, or maybe I slept. If I went to sleep at 2 o'clock or 4 o'clock or whatever, an inappropriate time. And when I say inappropriate, I'm not saying, oh, I should have been out, doing chores. I'm saying it's not the normal bedtime. So if I went to sleep before 9:30, 9:30, whatever time lights out are, that needs to be articulated. Sleep hygiene is extremely important, and it can affect so much. And so then you write a group summary. I got along with people, I didn't get along with people. I laughed, I didn't laugh. I was withdrawn. I sat in the corner while and watched everybody else play. You can articulate what you see there, and then how I participated. So this is also where you can note if there was a fight. So maybe Johnny and Jimmy got into a fight and I watched that fight. Then you can still note that two other clients got into a verbal or physical altercation, and Kate was witness to it, but she participated or she didn't participate. You can articulate that there. Then behavioral incidents, did I get into any verbal conflicts with people? Did I have a physical altercation with anybody? Boundary issues. Did I push a staff member's boundaries? Did I push another client's boundaries? And the boundary issues can be anything from, hey, threatening to leave, that AWOL risk, to, getting in somebody's face, or just, saying things that I shouldn't say. And then emotional distress, crying, anger, anything that shows emotional disturbance and distress. This is going to be key after a family phone call, or after something, maybe a discipline issue or whatever, and we're going to go, well, that's normal. You should have that. But it still needs to be articulated. Kate had a phone call with her son. After she got off the phone, she was tearful and stated that she missed him. Okay, great. That's an appropriate response. But at the same time, we need to know that so that we can start working on, hey, how did your conversation with your son go? Oh, it was great. So what made you cry? Oh, how did you know about that? Well, we're a team. We all work together, and we want to take care of you. What made you cry about that? Oh, well, he told me that that I was never going to change. And then the counselor can start working with them through how to respond to that, how to not accept that, not let that negativity sit with them, but then also how to deal with feelings, and that was an appropriate emotion to be told that, but yet at the same time not to let that stick to them. All right. Any property damage, I accidentally shut the door too hard and busted out a window. Well, if I've had 3 accidentally shutting the doors too hard and busting out a window in a week or even a month, that's not normal. That's not okay. So it's articulating those things so we can start to catch patterns. And then rule violations. If people are losing merits, if they are meriting out of the program, things of that nature, it's extremely important to list that here. Any self-harm concerns, so maybe I took my razor and I didn't give it back, or I was found to have maybe I was found to have a razor or a knife in my bag, or whatever. There's just different things that you can say here, but that will help you to articulate the self-harm. And then AWOL risk, they threatened to leave, they walked off the property but then came back, anything like that. So description, intervention, and response. This is where you can describe the behavior, what you did to intervene. Maybe you redirected them. Maybe you called in another staff member. Maybe you had to separate them from the group. Whatever the intervention was that you used, then you can list that there. And then what's their response? The description was, you redirected me because I was wanting to play Legos, and the Legos were already being taken, and so you directed me toward Jenga. And what was my response? I was angry, I was withdrawn, I was fine, whatever the case may be. You list all of that there. And then if there's a need for supervisor notification, anytime you have to notify a supervisor. So if you text a supervisor after hours, or when they're not on shift, it needs to be documented on this, because there's a reason that you're having to notify them. And the reason, what we're looking for, again, we're looking for patterns. We're looking for things that we can go upstream so that it's going to make everybody's life easier, better, higher quality, between you having to text that person at night, that person getting that text at night, but then also whatever caused it, because you don't just do that because, it's 9 o'clock at night and you want to tell Lisa good night tonight. You do it because there's something that happened, and so it's helping to go upstream and figure out what those things are. Excuse me. Meal and nutrition. So, what did they eat? Well, we had spaghetti. Did I eat all of my spaghetti? Did I eat 50% of my spaghetti? Did I not eat any of my spaghetti? This is important because it's going to help us if they're saying, well, they're not eating, or they're saying that they're not getting enough food, but yet they threw half their food away, or whatever. If we have this information, then it helps us to make better, more qualified decisions. It also is going to help us to figure out, hey, that meal didn't really, people didn't like that meal, or people love that meal, or things that we can do to just continuously increase and improve. Not increase, but improve. Spiritual, emotional. So did they ask for prayer? Did they go into the prayer closet? We have prayer closets. Did they go in there? Did they ask for a scripture or encouragement? Did you have to do some extra support with them? And we see this as normal because it's what we do day in and day out. But if you think about it, you're not doing that day in and day out with somebody at Walmart or even in a church pew. And it's not because, oh, well, that's just not what you normally do. It's because that's not the level of intervention that person needs. But people in our program do need it, so we need to make sure that we're articulating that. And then an end of shift handoff. So it's 10 o'clock and somebody else is coming on shift at 10:01. What is it that they need to know? Do they need to know that Kate and Kim do not need to be in the same room together because they are going to tie into it? Or do they need to know that Kate's been running 101 fever and she's been taking Tylenol every 4 hours and Miranda is aware, but they need to make sure they keep her on that regimen? This is just a great little couple liner just to know what's going on. If there's nothing, there's nothing. You would just put a line through it. Actually, I do not recommend that. I actually recommend putting something there that says Kate had a great day, or Kate's day was within normal limits, and we'll continue to monitor. And then any follow-up that's needed. So again, maybe it's something that I need to remind myself to bring the Monopoly game tomorrow night, or I need to remind myself that we're going to put up the Christmas tree in a couple days, whatever the case may be. Any follow-up that's needed. Also, hey, her stomach is hurting, she's running a fever, and she's having to take medicine every 4 hours. The follow-up that's needed is making sure that she gets in to see the nurse practitioner tomorrow, if she's still doing that, or making sure that we're continuing to take her temperature throughout the night so that that fever never spikes out of control. And then you will sign it and you will upload it to SoberPeer, the same thing that you would do with that soap note. All right, and then this is the last one. This is the RTC night shift. So this is going to be filled out typically from 10 until 6. This is probably the easiest one to fill out because everybody should be sleeping and there shouldn't be any issues, but this is your proofs in the pudding. So this is where you're going to identify, obviously, their information, and then you're going to say how often you're checking on them. Are you checking on them on 15-minute increments because they're on some kind of a self-harm watch? Are you checking on them every 30 minutes because maybe they're ill? Or are you checking on them every hour? And then there is the one-to-one where, like, dude is super sick and I'm staying with them and we're just doing a one-on-one. We shouldn't have any of those unless we have called an ambulance. If we've called the ambulance, then you want to make sure you articulate that. So up here, if they have the same throughout the whole night, then you would just articulate whichever one it is. But if you ever have to deviate, so we were on a 60-minute and then she threatened to hurt herself and we went to a one-to-one, then you're going to come down here and notate what hour it was. So you'll see, this is 10 o'clock, 11 o'clock, 12 o'clock. Maybe this was 11:59, and then this was 12 or 1:23. You mark what time you do it, and make sure there's no way that I've seen this before. I start my rounds at 10, and I started looking at somebody's note, and they put that they saw every patient at 10 o'clock. Well, there's absolutely no way that you can check on every patient at 10 o'clock unless you have 2, 3 patients in the same room. So make sure that whenever you're going from room to room, that you're looking at your clock, your watch, your phone, whatever, and not changing, but putting the appropriate time down. Because if you were ever to be sued, they're going to say, how did you see all 10 of these people at 10 o'clock on the dot? It didn't happen. So make sure you're articulating that. Was the client present? So I went into the room and Kate wasn't there. Well, then you would put no, and out here you're going to put, when I found her, she was in the restroom. Perfect example. Got it. This is where, but normally that should be yes. Make sure you're not drawing a straight line down, because if you do that, then they're going to know that you didn't fill this out as you went, and it's not going to be good. Then you're going to go over here to breathing, making sure the person is breathing. So, you can be listening for breathing. You can be watching their chest rise and fall. You can see them, I guess that's the two. You're either listening to them snore, or you're seeing their chest rise and fall to know that they're breathing. The position is safe, so they're on their side, they're on their back, they're on their belly, but this is making sure they're not like hanging off the bed. This is making sure that they don't have their head like between the wall and the mattress or something like that. And then any notes that you need to make. I like to, especially if somebody's sleeping through the night, I like to put over here, client is snoring and will continue to monitor. I like to just put that through here so that I can just keep coming back to it. And then this is where you would do your observation at the end of the night. Again, it's going to take you just a few minutes. Most of the people are going to be slept, no significant occurrences. But if you had somebody that was up and down, then restless. If you have somebody that never went to sleep, make sure you're articulating that they were awake. Behavioral concerns, whether they were restless, emotional distress, nightmares. If you're hearing somebody cry out, that's nightmares, night terrors. Make sure to talk about that. Emotional distress, they're crying more at night. They are more anxious, more fidgety. Maybe they're refusing to sleep by the window and they want to sleep on the other side of the room, whatever, making sure you articulate those things. Agitation. Maybe it's extremely important to notate like what time that is, because if it's 30 minutes after a medication, Miranda's going to want to know that. Or if it is 5 minutes before they have to take a shower, the counselor's going to want to know that, like what's going on with that. So make sure to identify those behavioral concerns. Medication safety, did they have any meds even? Most of the time this is going to be no, unless it's first thing in the morning, and then you would articulate that. Medical health events, so did anything happen? Any injuries, any blood sugar issues? It's basically the same thing that you did on the other. And spiritual emotional support. It is not appropriate to go pray at 2 o'clock in the morning if you should be sleeping in the prayer chapel. Now, that doesn't mean we can't. It means it doesn't need to be in all the time occurrence. It's kind of like fasting. We can't ask you to fast. If you want to fast, then we all need to be aware of it. So it's the same, a very similar thing. But we don't need to be praying at 2 o'clock in the morning and instead of sleeping, or more likely than not, going in there to sleep or whatever. Incidents, if anything happened, making sure that you articulate that, and then making sure that the staff have a good summary to hand off to so that they know what they're walking into that day. So that's how you fill it out. Again, most of these will take you about 5 minutes a person, maybe 7, if you have somebody that's more complex than not. But that is a quick overview. If you need me to spend more time with it, please let me know, and I'll be glad to do it. Until then, you guys have a great time.